Okay, so now that we've talked about the enteral methods, which are ones that specifically use the GI tract, now we're going to talk about paraenteral methods. None of these methods that we are going to discuss actually use parts of the gastrointestinal tract. So the gastrointestinal tract is not involved in any of these. That includes intravenous, when you inject into a vein, intramuscular injection, subcutaneous injection, inhalation, topical application, intranasal, which is insufflation or occasionally snorting, transdermal. So here are examples of a few of those just as a reminder. And you will notice that in general, remember that bioavailability is all about how much drug in the blood is available to bind. So what's really critical about getting drugs absorbed and distributed throughout the body is whether or not they have access to the bloodstream. And as you can see, one method has direct access to the bloodstream. So intravenous injection is one of the most rapid and accurate routes. It is directly injected into the bloodstream and it actually reaches the brain near instantly, ballparking about 10 seconds or just a little bit more. Now, I mentioned that part of the reason that an oral administration was so safe was that it's relatively slow acting. It takes about 20 to 30 minutes to actually have an effect. Now, in contrast with that, intravenous injection, IV, is one of the most dangerous because of how rapidly it works. If you overdose, there's no time to correct it. It'll be too late because of how quickly it enters the bloodstream, is absorbed and circulated throughout the body by the heart, and then reaches the brain. As I mentioned, this is especially true if you're taking street drugs. You are never 100% sure of the dose that you are getting or how strong it is. There are issues related with how sterile needles are. And additionally, many drugs that are sold on the street contain fillers that might actually be really dangerous. So that's kind of something to keep in mind. Now we're going to talk about an intramuscular injection, which is sometimes referred to as IM. Some examples of intramuscular injection include things like the EpiPen for people who have certain types of allergies where they may go into anaphylaxis. An EpiPen is directly injected into the muscle. It is epinephrine, and it's able to counteract the effects of anaphylaxis. Another example that you see here is Depo-Provera, which is a somewhat longer-term version of birth control. You go in for quarterly injections, and that is put intramuscularly. So an intramuscular injection is when a drug is injected directly. Now, muscles do have access to the bloodstream, but it takes them a little while to get there. So one of the things that we find relative to an intravenous injection is that it's slower and absorption is more even. It takes between 10 and 30 minutes to have an effect. You can actually slow intramuscular injection absorption further with vasoconstrictors. These drugs that are designed to constrict blood vessels. That includes things like antihistamines as well as amphetamines. Both of these are types of drugs that can constrict blood vessels. So if you are taking an EpiPen and you had an antihistamine earlier in the day, it may take a little longer for that EpiPen to have its effect because of that vasoconstriction. When the blood vessels are constricted, they can't really circulate blood as easily as they otherwise would. Subcutaneous administration. Odds are pretty good that you know of potentially somebody who is diabetic and receives insulin through subcutaneous administration, or you've heard of birth control implants, which are known as things like Nexplanon or Implanon. In this case, the drug is injected just below the epidermal layer of the skin. Now, one of the things about subcutaneous administration is that it's very slow and very steady. Somebody who needs a slow and steady supply of glucose throughout the day is going to need a subcutaneous administration. If you did intramuscular, you can't 100% be sure that it will be as slow and steady, and you might have a spike of glucose, which, if you're diabetic, can be pretty dangerous. So one of the things that we find is that subcutaneous administration is often absorbed at a rate that depends on the blood flow to that area. So you'll notice that subcutaneous administration for insulin pumps are usually located around the stomach, the digestive tract, and the pancreas, and that is designed that way for a reason. Inhalation and insufflation. So inhalation is when you smoke a drug or inhale it. Insufflation is when you snort into your nose or your nasal passages. In both cases, the drugs are absorbed into the bloodstream by passing through the lungs. When you smoke, the drug gains access to the lungs and is then pumped by the heart throughout the bloodstream. It is a very rapid effect. The lungs go to the heart and then finally to the brain via the carotid. And this is a pretty rapid effect as well. It takes about maybe 7 to 10 seconds. So like IV injection, it's pretty fast. The same is true with snorting. Now, there is potential damage to the nasal passages. If you are somebody that snorts cocaine on a regular basis, you are going to have damage to your nasal passages. Additionally, you can have damage through your lungs. We know, for example, that the compounds involved in nicotine cigarettes will often leave tar on the lungs, or filler materials might get caught in the lungs as well. Topical administration. This is a case where a drug is applied to various types of mucous membranes. Intranasal administration is a special type of topical administration that will include things like nasal sprays or snorts. They can have both a local effect, as in it can be decongestant, but it can also be a systemic effect as well. With transdermal applications, drugs are applied via a patch that is put in the skin. It is pre-programmed to a particular rate of absorption, which keeps them very, very safe. If you want to slow down that absorption even further, you can put it in an oil compound and slow that absorption down even further. Some pretty common examples of drugs that are applied through patches are nicotine patches, which are often given to people who are trying to quit a smoking habit, as well as certain types of birth control. Now, one of the things that you will notice is that the route of administration will affect bioavailability. And that's because the route of administration is related to the rate of absorption. The more quickly that a drug is absorbed, the more quickly it is available to bind. So one of the things that we find that some of the more rapid administrations, they're very fast acting. Their bioavailability is almost incredibly rapid, as you can see here with IV injection, as well as with certain types of intramuscular injection. But what we will notice with this is that bioavailability, once that drug has been absorbed, those fast acting methods are also the shortest lived in terms of effects. Now, on the other hand, oral administrations, subcutaneous administrations, and intramuscular injections embedded in oil, which slow down that absorption rate, they don't have as much bioavailability at any given point, but their effects last for a longer period of time because they are much slower to circulate and distribute throughout the system and be absorbed. Now, this can also be affected by metabolism of the liver. So let's talk about some of the different factors that affect the rate at which a drug absorbs in the body. So what kind of drugs can actually cross membranes? To understand this, you have to understand what a cell membrane is made up of. So that will include tissue membranes, organ membranes, brain areas, things like that. All of our cells contain a phospholipid bilayer. So we have these charged heads that are water-loving hydrophilic, and these are paired up with hydrophobic tails. So in this case, we've got these charged heads that are in contact with aqueous fluid. Now, I'm not really going to talk much about why this works the way it does, but we do know that the more fat soluble a particular molecule or a drug is, the more quickly it can pass through membranes. So the only kinds of drugs that can cross these membranes are ones that are fat soluble, not ones that are water soluble. Additionally, one of the other things that we know is that diffusion across this membrane works best when drugs are kind of neutral and they don't release ions. So one of the things that we know is that most drugs are either weak acids, their pH is slightly greater than 7, or they're weak bases, or acids are their pH is less than 7. Guess who forgot how greater than and less than works? Or bases where their pH is somewhat greater than 7. So one of the things that we know is that the more a drug ionizes, the more ions it produces, the less likely it will be able to pass through a membrane. So one of the things that we know is that weak acids are going to ionize in alkaline solutions, which is an alkaline solution is basic. A weak base is going to ionize in an acidic solution. So generally, for example, if you have something that is going into the stomach, which is by and large a very acidic solution, you want to make sure that you are dealing with something that is not basic. So for example, aspirin, which is somewhat acidic, is very easily absorbed in the stomach. It does not ionize because the acid is matching with an acid. Generally, one of the best ways to have this happen is to have that particular drug have about a neutral pH or slightly, which is at about 7, or be just slightly acidic or slightly basic. And we want to make sure that if we want this drug to pass through the membrane, that type matches type. If we know it's going into a base, we want it to be slightly basic. If we know it's going into an acid, we want it to go into something that's acidic. So yes, and by the way, ionization means that it produces ions when it's dissolved in water. So we want to keep that ionization from happening. The more ionization that occurs, the less likely that drug will be able to diffuse across membranes and have the effects that we want. Now, what other things affect the rate of absorption? So how often your stomach empties into intestines is important. And that's because with the stomach, you are going from a smaller surface area into a larger surface area. Your intestines have a huge surface area, and that means that they are going to move much more slowly. And that's going to mean greater absorption. The more slowly it moves, the more that things can be absorbed. So one of the things that we know is that if you vomit or if you have diarrhea after taking a drug, your stomach has emptied very quickly. That drug hasn't had time to absorb. It's part of the reason why if you take antibiotics and they make you have diarrhea or vomiting, they may not work as well. You didn't absorb them. Your size matters. Generally, the larger you are, the more of a dose you need. And a smaller dose will probably not absorb as much as a larger dose will. So your size matters. Your gender does too. In general, females assigned at birth tend to have more body fat and less water. And because they have less fluid volume, they absorb drugs more rapidly and feel the effects of drugs more strongly than those who are assigned male at birth. All right, so I'm going to stop here and I will have more for you later today.